Hi, and welcome to HumanityRx, where we are sharing stories that highlight the human side of healthcare and bringing you life lessons from the bedside. We are your hosts, Jenny,
Tova,
and Jonathan.
And we're glad you're here. Our guest today is Dr. Chethan Sathya. Thank you so much for being here today. We're really excited to hear from you. If you would just take a moment to introduce yourself and tell us a little bit about your relationship to healthcare.
Jenny, thank you so much for having me on today. It's really an honor. So I work at Northwell Health, which is the largest health system in New York. I'm a pediatric surgeon, and I'm also our trauma director and the director of our Center for Gun Violence Prevention. And, I'm really, really fortunate. I think, one of the things I hope we can talk about today is being able to work at an institution that really cares about the health of the entire community, no matter where you sit, no matter what beliefs you might have. Northwell really, for me, embodies that type of care, that empathetic care where it doesn't matter what we're doing. We just care about the health of the community, and something that most Americans agree on.
I think that is not the case for everyone. So that is wonderful that you are able to have that experience. Can you tell us a little bit about your journey through medicine and how you got to where you are and some of the things you're involved in advocating for?
Yeah, absolutely. I came to the United States about 6 or 7 years ago, originally from Canada, did my training there. Both my parents are from India. They're both physicians. And that was really, of course, pivotal kind of in my interest to want to pursue medicine in the first place. And during medical school, surgery was it. I never really looked back. It was kind of this opportunity to work with families, work with adults, kids, take them through a really horrific time in their lives, and be able to actually cure something, right? Be able to actually deal with a tumor, deal with an injury. And to just see that kind of impact that you can have as a healthcare provider was something that was astonishing to me. And that's kind of the reason I went into surgery specifically. And then when it comes to pediatric surgery, it's a very unique field. We treat babies, fetuses, kids, teenagers. So anywhere from fetus to newborn to 18-year-old, we treat. And the amazing part of that in this career really is throughout the spectrum, right? Whether you're treating a baby, an adolescent, you get to work with families, you get to work with parents. And, I have 3 kids myself, three beautiful girls. Can't imagine how resilient these parents are. Even in the face of adversity, in the face of their kids being on death's door, having really, really traumatic things happen to them, the resilience has been incredible. And that's what honestly drew me to pediatric surgery. Not to mention just the surgeries we do are really incredible. But that was really at its core what brought me here. And then from an advocacy lens, we can take a deeper dive based on which direction you want to go. But it became apparent to me very quickly that as surgeons, we treat the issue, right? We treat the injury, we treat the bullet wound, we treat the cancer. And then our patients, their families, those kids go back out into the community. But often we don't think about the larger macro effects, right? Like, how can we make impact at a much larger level? How can we work on a public health issue? And that's what, at the end of the day, really made me want to pivot to a lot of advocacy work, working with government, health systems, public health, and so on.
Yeah, that is incredible. Thank you for doing that work.
If we I think about it as like small a advocacy and then big A advocacy, and the small A advocacy being like those relationships you're talking about with families, and then the big A advocacy being the work you're doing on that macro scale. So if we like rewind and think about the micro advocacy, I would just love to hear, because especially becoming a parent, I feel like that shifts when you're working in really intense situations with families. And if you could talk about how you stay present with your families that you're working with, and then also be able to go home and, not feel that weight.
Yeah, it's a great question. There was definitely I think whether you have kids or not, we all have children in our lives, nieces, nephews, friends, family, so on. I certainly for myself did notice a huge shift once I had my own kids, not only in my ability to be able to really connect even deeper with families, but as surgeons, we often are trained to kind of desensitize, right? And this is because we have to, right? We have to, if you have multiple people who are injured, multiple conditions, right? Or complications during surgery, it's really intense. You can't perseverate on that, right? You have to move on. And if you don't move on, and if you don't desensitize, you're going to be destabilized, and you're not going to be able to offer your patients the best care that they need. At the same time, to your point, I told you have to balance the empathy, bring the empathy in, but then be able to kind of move on, right? And it's a struggle. And I think when you have your own kids too, or something that draws you in like that, it has made me a better doctor in that, I am able to just understand too, or just be able to reflect on what those parents are going through during that tough time. Because you can't help but think about your own situation. Like, what if this was my kid? Right? It also allows you to center and say that, listen, I am going to treat your child the same way as I would treat mine, because you fundamentally believe that. So that micro advocacy piece, I think it's a great point, and it's definitely a shift. And I think it also just speaks to broadly across the field for any healthcare workers, nurses, social workers, physicians, it doesn't matter, PAs, NPs, the impact you can have from those simple interactions, that empathy towards a family. I mean, it's absolutely monumental. We see people embrace those conversations in different ways. And I can tell you just the impact you can have on a family by being present, like you said, is huge.
Yeah, the desensitization is a really interesting point. And, for anybody out there listening that may not have a medical background, or, we're all healthcare providers, we are not physicians. So I'm curious if there's any specific, when you say training, just any specific thing that you can give as an example about how you get through something like that, other than just deal with it, right? Because that's, I think, how we come to it, is that I think we were speaking with someone recently who's like, yeah, I need to step outside for a few minutes. But like, is there actually like something that you are trained as a surgeon to get over these difficult situations to move on to the next child?
Yeah, I don't think so. The simple answer is there is no real training, but things are getting better. Right. And I say that in that I think it's different for every single person. You guys talk to a lot of folks on this podcast. You're going to find different personalities react very differently. I do think that largely in our training, that part we just kind of have to figure out. And that's not the way it should be, because I do think that when you go home, you then think about those cases. Right. And I think that's where now I'm seeing a lot of momentum in training around how to de-stress, how to talk about those issues, right? Not to just put it in one bucket so it comes out later. So that piece is getting better. But the actual acute moment, Jonathan, like you said, I think very much it's up to different individuals. And for me personally, I definitely, I think a huge thing to point out is just the team structure. Like the supports you have around you are monumental. If you're in a team that doesn't have your back, that isn't there to hold you up during those times, it can be very lonely and very tough. And, in all the healthcare organizations I've worked at 3 or 4 now through my training, and now here at Northwell, the teams are incredible. These are folks, as you mentioned, not really, the physicians are just one small piece of that, right? Everyone, the scrub techs, the nurses, the OR administrator, the chaplains, and so on. Everybody comes together. And difficult moments, I've definitely seen a huge momentum shift where these debriefs, we have something called a code lavender, right, where we all debrief and talk about these issues. They really do make a difference because everyone reacts differently to these topics. Now, and I will talk about some cases specifically, right? One of the topics we're going to discuss today is gun violence. And, having to desensitize when you see kids who are shot day in and day out, and this is a preventable issue, does become hard and frustrating. Right. It becomes particularly frustrating because it's preventable and you're trying to make a difference. You're trying to achieve change. There's a lot of common ground there when you talk about polarized topics like gun violence prevention. But that frustration is tough to deal with.
I think that is an issue, and globally for healthcare workers, that has yet to be addressed correctly, the whole mental health aspect of it. But I'm glad that we see some positive changes. Can you tell us, Dr. Sathya, about a specific story that had a significant impact on you?
I'll share two. I mean, there was one that continues to stick out kind of in my mind. I was a trainee in Montreal, in Canada. And this is what initially got me interested in trauma in general, right? Now, and just to clarify, right, as pediatric surgeons, we treat a whole host of different things. We do traumatic injuries, but we also do cancers, congenital deformities, fetal deformities, all of it. But as you know, a big part of my role is focused on trauma as well. But I still remember, right, there was this 4-year-old girl who came in after being run over by her dad with a lawnmower by accident. And the reason it sticks with me is because at that time I didn't have kids either. But I just, I revisit that story a lot because I think about that dad that mom and that child died. We tried to save her life. Unfortunately, it was a horrific 12-hour case, but I just can't forget, like what is that dad going through? Where is he now? What happened to him? Right? What happened to that mom? And so that's a case that sticks with me and wants me to not wants me to, but inspires me to do more, right, across the spectrum, because those kind of things are avoidable. But it's a great example of, not a great example, it's a horrific example of how tragic these situations can be and how it can really have ripple effects across the community and that family. And so that's certainly a case that sticks with me. And then one case that brought me to the gun violence issue very prominently that I do talk about quite a bit was the first baby I treated with a gunshot wound in Chicago. And, this was after training in Canada. I had treated a number of adults with gunshot injuries. And it was my first week in the job in Chicago. And the 6-month-old baby came in with a bullet wound, through and through the abdomen and pelvis. And one of the things in pediatric trauma is that the parents come into the trauma bay with you. So even for the case I was talking about earlier with the lawnmower, the parents are there with you while you're treating the child. And so you can just imagine, right, the horrific expressions that these parents have, what they're going through while you're trying to save this life. And I still remember this baby, I had both fingers on the bullet wounds, blood was gushing out. I remember what her earrings looked like. I had my own daughter at the time as well, to your question earlier. And all these things are going through your mind. And so you have to zone in at that point and rally the team, right? I think these pediatric traumas can be very traumatic for the whole healthcare team. And so everyone's got to rally, everybody steps up. But you have to, that's a critical example of how you have to separate what you're doing from the emotions you might have. And that baby actually did survive, but remains paralyzed, unfortunately, to this date. Really speaking to the disability that happens when you are shot if you don't die, and that was just a baby who was sitting in the back of a car in a car seat and was shot.
That's terrible. Like, honestly, you see so many terrible things. I remember somebody that I was talking to regarding these kind of very traumatic events. And my question was, well, how do you deal with this? Such a large percentage of the people that you treat, you lose. And they said, well, the other 50%, though, they survive, right? So I have to do it for them because I'm their best shot. I have to give it a shot. So thank you.
Yeah. And I wonder, it's maybe on the flip side, those stories of the miracles that you see also. I mean, there's the traumatic part of it, of course, that are very moving. And, I personally never wanted to work with peds because of because of some of these stories that you're telling. Because I think I had one experience of a 14-year-old getting shot by her dad, and I'm like, I can't do this. It's not something for whatever reason, I can handle an 18-year-old or a 25-year-old, but it just really hits differently, very different. And so for me, it was, I kind of bailed on the peds, right? But, maybe those other side of the stories that are, wow, this is why I do it, not because of the devastating things that are just tragic to anybody, but like maybe the other side as well, about the miracles that you see.
Yeah. That's a great question, because that's a common question I get too, is, wow, it must be so tough, or why did you want to do that? That's exactly right, Jonathan, is that it's actually the resiliency that kids have and the fact that the majority of them do very, very well that keeps you going, right? And kids do very well, right? So yeah, though we can focus on tragic cases here and there, even when it comes to overwhelming bacterial infections, major surgeries, little babies, 500-gram babies who we're operating on, the amount of resiliency they have versus a older adult is incredible. And so I would say it's not even 50-50. I mean, it is 95% good stories, right? And I think so that certainly balances a career like this. It's a very fortunate position that we are in, working with kids in general. Because of that reason, you can have tremendous impact. Kids go on to lead an entire lifetime and a healthy life as well. And this includes cancer diagnoses, right? A lot of kids with cancer actually do very, very well. So I'm glad you asked that question, because it is certainly a privilege and a joy most of the time for these situations. And then when you have the tragic cases, you reflect on it. And I think it drives you to say, what can I do more? How can I not take on an issue and advocate for more, whether it be gun violence prevention, other traumatic injuries, you name it.
You said 95% of the time you have these wonderful outcomes, but a lot of us in healthcare, we spend our days haunted by the 5%, right? And like thinking like, what can we do different next time? How can we do better? And sort of like reflecting on that. And I think that's what makes you, part of what makes you really good at what you do.
Yeah, no, it's a great point. You have to reflect on that. And then you have to also just, a question for all of you too, is how do you also maintain, not get frustrated, right? Because increasingly there's more and more hostility towards healthcare workers. And what I mean by that is, whether it be misinformation or just lack of trust, that is an increasing issue. So I'm happy to answer that, but I'm curious from all of you too, how you kind of combat.
That's one of the reasons we started this podcast, to be honest.
Oh, perfect.
We want people to see this human side, to see that we really do care about you. We spend a lot of time in school learning these things. I know a lot of people, med school is a sacrifice, right? You spend a lot of time away from your family, from your friends. You have to miss out on things, but your goal is to help.
I think we as a field have to communicate this better as well. Is that it's not that we want to be overly dogmatic or prescriptive about what someone should do or should not, but we have gone to school for a while, right? Like we're trying to make the best recommendations we can based on the evidence we have. But I think just these conversations around communicating that we are actually empathetic with where that individual is coming from are important. And, gun violence is another issue that is a good example because it is so polarized. And I think broadly public health, not hospitals necessarily, but public health hasn't always done the best job empathizing with why people might have certain beliefs about something. And, that's the way we approach our conversations on gun violence, which is a very contentious topic, right? It's about safer communities, less violence, no mass shootings. And I have not found one American family of tens of thousands of families that ever disagrees with that. Like, I don't know one family that doesn't want their kids to be safe, less shootings, less mass violence, right? Like that's just not a thing. So it's just the way that we approach a situation without vilification in a non-judgmental way, I think is very important. And I think that's, something that's incredibly important for folks out there to know.
Yeah. I was going to say, I think we can all agree that nobody wants to hear stories about bullets in babies, right? Like it's just.
Right. Yeah. It's just how we get there. And in any other job, mistakes are just so tolerated pretty well, right? And in this job, mistakes, the bar and threshold for a mistake is very, very low because it's life-threatening, perhaps in your situation, but in even just like a scheduling error for someone going through, surgery tomorrow versus the next day, or the labs today, labs tomorrow. I think that's where there's a little more heaviness on everything that we do because of the expectation is so high. And so it's not to say, hey, everybody out there, we're human, give us a break. It's also just to kind of bring that up as a point, is that it's, we have to be into what we're doing. Like this is not an easy thing, but it's also the everyday aspect of what we do is very special and unique to the person going through it. And then we have to remember that, I think, that we see 1,000 of these situations perhaps, but at that individual person, it's very special and unique.
Yeah. Yeah. I think that's well said. And, there's no question there's a systems issue with healthcare in America, right? I mean, there's numerous points of frustration, whether it be payers, insurance, administration issues, tasks, regulations, you name it. But you're right. The humanism of this and the human standpoint, right, doesn't mean that the systems issues are all because of individual folks or hospitals, right? There's a whole ecosystem there.
So we always end by saying we could do this for 6 hours, and you're no different in this situation. We want to see if you can leave our audience with what we call a prescription for humanity, something that you may want to give as a takeaway or word of advice. And these are for people listening that are healthcare providers, caregivers, people who've gone through healthcare journeys. So it's kind of covering a whole gamut. And we would love you to leave us off with something there.
Yeah, it's going to be broad, but I think it's probably the most pressing thing on most of our minds is that, don't forget that there's always common ground with folks. We have to resist the idea that there's a them versus us mentality, or that people have beliefs that are so divergent, because then we just shut down listening. And I think whether it be healthcare workers or patients, both ways, that is how misinformation can spiral out of control and is spiraling out of control. That's how silence can develop. That's how tribalism develops. And I think that we have to be active participants in stopping that, because that means honestly listening, with an open mind, without judgment. And I think just remembering that if you really meet somebody that you're like, wow, I just have very different views than this person, that's almost should be encouragement to want to listen to that person and understand those views.
I think that's so important. Thank you for saying that. Thank you for being here and the amazing work that you do. To everybody listening, we hope to see you back for the next episode. And Dr. Sathya, thank you again.
Thank you for listening to HumanityRx. We hope today's conversation gave you something to think about and maybe even feel a little more connected to the human experience. To find out more about our guest, please find more information in our show notes. HumanityRx is created, written, and produced by the three of us, Jenny, Tova, and Jonathan. If you enjoyed this episode, we'd love it if you subscribed, left a review, or shared it with someone who needs a little dose of humanity. You can find us on Instagram at HumanityRxPod or LinkedIn at HumanityRx. Until next time, be good to yourselves and each other.